The Birth Center at Salina Regional Health Center recently won the KDHE Best of the Best Award in Metabolic and Newborn Screening. RN Cassidy Dozler joins me today. Well, Cassidy, thank you so much for being on the show. And would like to congratulate the Birth Center on the award that I mentioned in the opening. Why don't you tell us about the award?
Thanks, Mike. So we got the Kansas Best of the Best Award. That was the KDHE, the Kansas Hospital Association, and the Kansas Midwives came together and recognized and honored 131 different facilities that do birth in the state of Kansas. And we were one of 12 to win the Best of the Best Award for metabolic screenings.
Why don't you tell us a little bit about, what are those screenings that you're looking at?
So they recognized hearing screens, CCHD heart screens, which is a congenital heart screen that we do, and then metabolic screening, which is what we got the award for. The metabolic screening is a heel stick draw that we do. We poke the baby on the foot and we get 5 drops of blood and then send it into the state. That screening does multiple, like 30 different metabolic inherited genetic tests. So for example, like a thyroid test or something like that would be something it would look at.
Let's talk about why it's important to do this. What type of diseases are you catching, and why is it important to catch them early?
Millions of babies in the United States are tested each year, and 13,000 of those million babies come back with having something like sickle cell disease, hearing loss, congenital heart diseases, things like that. So catching those early, all the things we test for are treatable. So catching them early gets treatment started early, has better outcomes, saves lives, and in the end ends up saving a lot of money getting on top of it sooner than later.
So obviously you're doing something right, to get the Best of the Best award with the other 11 facilities in the state of Kansas. So what were some things you did, or what did you do to get that?
It's really just our standard practice. We always try to implement best practice on the birth center, and we just keep doing what we've already been doing. So after the babies are 24 hours old, we do the CCHD heart screen and we do their newborn screen. We've worked hard to make sure that we're drawing accurately and getting good tests sent into the state, but other than just continuing to be diligent with what we already do. We just got recognized for doing what we already do.
Just so people can kind of have an idea, how many tests we're talking about, how many deliveries happen up at Salina Regional?
The number kind of fluctuates. I would say on average we do somewhere between like 85 to 100 deliveries a month.
Well, thank you so much for being on the show, and thanks for everything that you guys are doing up on the Birth Center. And thank you for watching. For more information, visit the Birth Center page on srec.com and like Salina Regional on Facebook, and follow them on Twitter and Instagram.